Candice. I'm one of the nurse practitioners here at Restorative Injectables. And today we're going to be talking a little bit about doing a thread lift. So PDO threads are basically dissolvable suture that plastic surgeons redeveloped for cosmetic and aesthetic uses. And so we will place them under the skin. So you get some initial lift from the thread placement itself, and then you get continued improvement as the threads dissolve over time. So there are a couple different types of threads that I use. So there are threads that are called smooth threads, and then there are also lifting threads. The difference between the two, I will use the smooth threads when I am concerned about skin texture, kind of the crepey skin that we get under our neck, as well as the crepey skin under the eye. Smooth threads can be really great for that. And then the lifting threads are for any patients who are wanting to get a little lift, maybe their nasolabial folds, to jawline tightening or correction. So some of the common places that we can do thread lifts on are doing a brow lift. So you can actually place threads above the brow and to the side of the brow. And I will do that for patients who feel like they have a low natural brow position, as well as patients as they age, they get that heavy upper eyelid skin. Threads up here will lift that eyelid skin out of the way. Other common areas that I get asked about as women age, they feel like their face is sagging and everything's just kind of falling front and center. And so placing some threads back here in the cheeks to lift the cheek position, nasolabial folds. You can also place them along the jawline and above the jawline to correct the sagging of the pre-jowl sulcus. Additionally, another place that we like to do threads is the neck. 3 again is too young for the crepey skin that sometimes happens as we age here in the neck. Doing smooth threads can correct that and tighten that skin. Threads can also be placed on the body. I've done it for sagging skin above the knees, above your elbows. The sky's the limit for where you place them. So before we get started, we use injectable lidocaine to numb the area that we're going to place the threads in. I equate it to being at the dentist. Most people feel the pressure, but they're not feeling pain during the treatment itself. So treatment time varies, and it's really dependent on how many threads I'm placing. Typically a brow lift takes about 30 minutes. Lower face, that's usually about 45 minutes, maybe an hour. To do a full face and neck, that generally takes about an hour and a half. After you get your thread treatment, I always advise against any cardiovascular exercise or weightlifting for 72 hours. We want to give the threads time to integrate into the tissue and stay right where we put them. Icing feels really good after the treatment, Tylenol and ibuprofen as needed. Healing time varies. Some patients really don't have any discomfort or swelling. Others find that they have some swelling and discomfort for the first couple of days afterwards. You can resume most of your normal skincare, but you will have insertion sites where I put the threads. You don't want to get any products in that area until those heal up, which is usually for most patients about 3 days. Results after threads take some time. Threads stimulate collagen, and for that collagen process to take place, usually takes about 6 to 8 weeks before you can see your results, and tend to last a year to a year and a half depending on the patient. If you are interested in discussing a thread lift, come see us at Restorative Injectables. We'd be happy to talk with you.